Hello, my name is Tom Gross. I'm in private practice with Midlands Orthopedics in Columbia, South Carolina. My practice is limited to total joint replacement. I hold no academic appointments. I have performed over 800 hip surface replacements since 1999. Total hip surface replacement is fast becoming a popular option with young active patients. They prefer it to standard hip replacement for the following three reasons. It is bone conservative, hip stability is normal, and there's great durability. Consider the reason that most people have hip replacement surgery. The cartilage is worn away. It then follows that the minimum operation required is replacement of the cartilage surface with an artificial bearing surface. Unfortunately, unsuitable implants have made this an unreliable prospect in the past. Early attempts at metal polyethylene hip surface replacement in the 70s and 80s met with very poor success rates, approximately 30 to 40% failure rates within 3 to 4 years. This was initially thought to be due to femoral neck fractures due to notching or osteonecrosis due to surgical devascularization. However, reevaluation of these results has led us to believe that most of these failures were actually due to polyethylene osteolysis. Modern metal-metal bearings were developed in the 1980s. Multiple basic science and clinical studies have shown excellent results with metal-metal bearings since that time. The three most common criticisms of metal-metal hip surface replacement have been: Number one, metal ions. This was best studied and reported on by Missouri in Clinical Orthopedics and Related Research in 1996. Complete discussion of this topic is beyond the scope of this presentation. However, there really is no good evidence that metal-metal debris or metal ions are any better or worse than ceramic particulate debris or polyethylene debris in the body. Number two, lack of long-term follow-up of hip surface replacement. Derek McMinn has published a series of over 1,000 patients with 8 years of follow-up, achieving 96% survivorship. Numerous other reports with midterm follow-up of 5 to 7 years show similar results. This is in young active patient cohorts. In contrast, if you look at metal polyethylene total hip replacement in young active patients, there's approximately a 20 to 30% failure rate, and there's often massive osteolysis. This poses a very difficult reconstructive problem. Most surgeons feel that the best option for young patients are total hip replacements with metal-metal, ceramic-ceramic, or cross-linked polyethylene bearings. The fact is, the clinical results on these types of implants, although promising, are even shorter than metal-metal hip surface replacement. Number three, biological failures of the proximal femur. There remains a 1% femoral neck fracture rate, much lower than was achieved with metal polyethylene hip surface replacement devices. Also, there is a 2% failure rate due to early femoral loosening or osteonecrosis. So, in total, approximately 3% early biological failures with hip surface replacement seems to be the downside to trying to save the proximal femur. On the positive side, there is minimal bone removed. I've never seen a case of osteolysis in 7 years. There's only a 1% wear rate compared to standard metal polyethylene bearings. Full activity without restrictions can be allowed. DVTs are rare. Thigh pain does not occur. There are no dislocations.